This is the Board of Health October 9th meeting, and it is 7 p.m. We have a quorum, so why don't we go ahead and get started. Our 7 p.m. first item is a public hearing on the Code of Conduct and discuss and possible vote on adopting the Board of Health Code of Conduct. The Code of Conduct is in the packet and it's online. There have been several modifications to this. Francis, do you want to walk us through this?
Sure. So I put it on tonight with the red lines, just to see if there's any more comments, alterations, edits that any board members would like to see. I'd like to bring a final copy to the next meeting to vote on. So we've seen it a couple times, but I just want to make sure before I make the final version.
I agree with that. I think member Mr. Kane there had some comments about it the last time, and we can just review quickly to make sure that your comments were addressed.
I'm reviewing again real quick. I looked at it earlier today, but because I didn't see anything jump out at me.
And I reviewed it earlier as well, and I didn't see anything come out as well. Gino?
I lost Gino.
Looks like we lost Gino. We're below quorum at this point, so I'm going to have to put a pause on the meeting. So, because we are below quorum. So, everybody pause. Please hold.
So even though we don't have quorum, we can still have informal discussion.
Oh, absolutely. Oh, Gino has returned. Hello, Gino.
I'm right here. I just want to make sure the phone is getting charged.
Got it.
I'm over here.
All right, we got you. Real quick, Gino, did you have a chance to look at the Board of Health Code of Conduct that was in the packet?
I noticed, yeah, but I know that we're going to have another meeting at the library, right?
So, Gino, we can discuss it at the retreat, but it's probably something that's better suited for a regular agenda item, unless you feel strongly about it.
I think we don't need to necessarily discuss it at the retreat, in my personal opinion. But let's just, so Gino, do you have any comments about it for this evening?
I don't have any, no. Everything's okay. We have 3 people here, and eventually those 2 were not able to come, but nevertheless, if it would be okay.
Yeah. This is a public hearing. Do we have any other comments or anybody in the audience that would like to chat about it?
Okay.
There's nobody in the audience at the moment.
Okay. Well, yes, Dan.
Hold on. I'm finding it's kind of broken up funny. Section 3, line K. We still have that never publicly criticize an employee of the town. I think that was one of my points from last time of how we quantify that. Obviously, it's at the discretion of the board to take action or not based on the code of conduct. But I think this is one of our discussion points that where is that line? And we'll pick on Francis because he's here. If we go, hey, Francis, we asked you to do this for this meeting and you didn't do it, that's a concern. Would that you didn't? I'm just using you as an example. Would that be considered criticizing a town employee publicly if we simply had a concern with some action happening within the department, whether it's Brenda or Francis or anybody else? I mean, I guess that piece of obviously it's up to the board to decide where that line is, but it just seems kind of I don't know. It's kind of a vague one going where is that line, and I'm not sure if it's a true concern or not. It just I don't know. It seems kind of. I'm assuming it's meaning as a member of the board, that certainly as a citizen I should be able to have opinions about a town employee. But I don't know if this applies to universally, that I can't stand up in town meeting and go, I have a problem with the town administrator. I don't. But again, where does this fall? Is this for all language? Is it only an official Board of Health language? Is it only during board meetings? And then if it's any of those settings, where is that line between publicly criticizing? Because that really could simply be you were late for this meeting, and that's a problem. That could be considered publicly criticizing, and then I'm trying not to make a big deal of it, but I am just trying to make sure that we're clear of what we are agreeing to when we say that. Does this mean we can't stand up in town meeting as a resident and say I've got a problem?
So I think we had a vibrant discussion about that a couple, 2 or 3 meetings ago, at least one that I was at, unlike the last one. And I think we said that, we were going to try to focus that a little bit more, or even strike it. Francis, do you remember?
Yeah, I vaguely remember. It might be worth striking just because I don't think there is any good way to word it. And I think that's why it might be a little vague to begin with. Because, Dan very well could stand up at town meeting and say as a resident, and that is fully within his right.
Yeah.
Thank you, Francis. That's the same look I'm having going, I get it. Yeah, we want to be responsible and we don't want to stir the pot as town officials. But on the other hand, where is that whole First Amendment versus professional responsibility line fall on any given day or any given situation?
I'd say, let's go ahead and put a strike through for that one. And let's just have it a point of discussion for whenever we discuss this at our next meeting when we have all of our members here. Because I think that'll be a good thing to do. What do you guys think?
I think you're right.
So I'll redline it in the final version still.
Yeah,
I'll just make
absolutely.
a notation on it so people see it ahead of time.
Yeah, Dan, what do you think? Does that sound like a good approach? Okay.
Yep.
Cool beans. Because I seem to recall that vibrant conversation around that the last time. All right. Any other go backs? Alrighty, so this is a public hearing, so what does the board move to do?
So my suggestion would be I will finalize the version to discuss and potentially vote on at the next meeting with the noted red line item that Dan had.
So we should
And,
continue this then? All right. Dan?
I'll make a motion that we continue the public hearing around the Board of Health Code of Conduct to our next regularly scheduled meeting, which is, October 23rd, 2024.
Oh,
I have a second. Hey, Kevin Baker. Do I have a second? I couldn't hear you, buddy.
you talking about me? Huh?
No, I just couldn't hear. I need a second. We have a motion on the floor to.
Okay, I'll make a second. I second.
All right. So the motion on the floor is to continue the discussion on October 23rd for our Board of Health Code of Conduct. So that way we can have every member present and go over that.
That's good.
So just so Kevin knows before we continue it. So we just talked about the code of conduct, and the one item that we want to keep on a red line is section 3K, which talks about public comments about staff, essentially.
And for publicly criticizing staff of the town.
It might be worth striking that item because there's no good way to word it. and it is a little vague in the way it's presented. So, and I think that's the problem, is because there is no good way to word it. And Dan brought up a very good point about being a resident and when is his right. Basically, he could stand up in town meeting and be able to make a comment as a resident of Littleton, and that's a little different. And where do you draw that line? So we'll put that on, and I'll note it for thought for the board to think of for the October 23rd meeting. Otherwise, I didn't hear any other alterations unless you had some, Kevin.
No, so I was just going to say we have a motion and a second on that. We'll do a roll call vote if possible. Mr. Baker,
Kevin Baker votes yes.
Mr. Kane,
Dan Kane votes yes.
Mr. Fratelloni,
Mr. Loney, yes.
and the chair, Kevin Davis, votes yes. All right, so that is our that's our 7 o'clock item. Our 7:05 item is a discussion to the Board of Health retreat. So this is just a discussion. We're going to review possible agenda items and dates. So Francis, when is the date for our retreat?
So we have October 21st from 11 to 2 at the library.
Yeah,
Refreshments and light snacks to be provided.
Okay.
yeah, October 22.
Yeah.
21st, Gino.
So that's a
25th.
Monday.
Thank you. Monday.
Monday, October 21st.
Thank
Okay.
you. Yep.
Alrighty. And let's see.
So our discussion would be, what kind of items do we want to put on that agenda?
Right.
Obviously, we have many, but
Well,
where
why
do we
don't
want to focus 3 hours?
Yeah. So, do any of the members have any ideas that they would like to have on the agenda? Mr. Baker.
When I first ran for the Board of Health and started learning about everything we're responsible for, it dawned on me that it would be a great goal for this board to become an accredited Board of Health. And I know it's a very difficult thing to do, to become accredited, but I think that should be our ultimate goal. And it might be part of a 10-year plan, but I think we have to put it out there and start to work backwards on the things that we need to do to get close to that goal. And I'm sure we can all I'm sure Francis knows all about it and what needs to happen, and can guide us in the steps that we can take to get closer to that goal. So that's my top priority.
Okay. That sounds great. Dan.
Yeah, to kind of follow up on that, I know I have gone through it, but it's been probably 15 years now. I'm not sure about other members of the board. The Mass Association of Boards of Health does a new member orientation program, and they do continuing education every year around rights, responsibilities, and authority of boards of health. What that piece of what are we responsible for? Obviously every board can have different things and different responsibilities in their communities, but there are some things that are relatively global across the state. And it's a great opportunity for new board members to really see both what the responsibilities are and also what the scope of authority boards of health have that they may not be otherwise aware of, which is a great opportunity. I'm not sure who else has gone over the years. I'll be honest at this point. I'd love to go back again because it's been so long. And it was a one-day kind of piece. But it was a great crash course into things to think about as a new board member and as a board member in general. Some other things I had really just kind of some update kind of stuff. So we talked about kind of a 10-year plan of kind of figure out where we are with our transition plan. At this point, Francis has now been with us for 3 months.
6 months.
6 months.
Yeah.
So time flies. So we're 6 months in now to this new situation. So I think it'd be really helpful to have a really solid understanding of, okay, what is the state of the department? Where are we at? What's things have been kind of transferred or cross covered, what things haven't, what we still need to do to support this transition. I'll be honest, I'm not sure if we have a warrant on the town meeting. I have not seen anything come from us as far as a warrant, a warrant article regarding the leaving the Neshoba. So that means if it's not on that, then that pushed us out another 6 months until the next town meeting before we'd be able to have a warrant article, because we can't leave until the town meeting votes that we can leave, and then we have to notify, and then we have our clock. So, but
they
some
did in
of those kind of
spring.
transition plans.
They did do the vote in the spring.
We did. Okay, and they've been notified.
Yep.
Awesome. All right. So kind of like what? So certainly now, if 4 o'clock is running, where are we in our transition plan? What things have been covered? What things we still need to identify resources for? What our staffing plan needs to be as we take over the responsibilities? How are we going to meet the nursing pieces? Certainly Francis in our small town will be a busy person, but we should be able to handle most of the requirements, most of the expectations of the position, with the exception of not having a nursing license. Nothing against you, it's okay. But there are pieces that we need a physician of record for both nursing practice, but also, we have to have a physician on record for anybody who requests an exam. We need to be able to have a contracted provider, to the best of my knowledge. So there's some of these pieces that simply we need to figure out what we know and what we don't know, and what we need to do to make it happen before we lose that connection. I'd love to talk about some kind of transparency of how we improve. It's great having Francis here, because actually the Board of Health is putting out notifications like EEE status has changed and those kind of things, which is wonderful. I love seeing it. Are there other pieces around that kind of outreach, education, injury prevention, and talk about just information transparency? That would be really a great way of seeing it. I don't know how transparent we want to get with inspection reports and some of those kind of things. You go to Boston and everybody has a grade on their door. Every restaurant has a grade on their door. You go to Westford, every restaurant doesn't have a grade on the door, but it says, if you want to see the report, ask for it or contact the Westford Board of Health. Every restaurant has that notice that it is public knowledge, and if you want to see it, you can see it. I don't know where that line is, if there's a line for Littleton of what we want to do, but I think it'd be an interesting discussion of how much information we want to share easily, and have expectations to share without going a freedom of information request. If I want to see an inspection report on a restaurant, and that's something that we can, under our authority, could take care of, but that might be that level. How transparent do we want some of these things to be? Maybe a great opportunity to discuss as we're all together in a little more informal setting. As well as for us, I know I've asked a couple times since Francis has been here, and I've certainly asked since I joined the board, of that piece of how are things going? How many inspections have we done? Have there been any issues or results? If we say, hey, we've done 12 inspections and they've all been 100%, no issues, no nothing, not even like a dirty fork, I'm just as happy to hear that positive feedback that things are awesome as I'd want to hear going, no, we have a few places that have some issues and they're being addressed, or we had to close somebody for 48 hours while they fix their hot water. All that pieces, it's kind of nice to know simply that the job is being done, that we're responsible for overseeing. And I think that's another piece I'd love to see of how we can, do we want that? How do we want that to be handled, shared with the group? And then maybe just some updates in general. How are we looking for opiate? What do we need to do for the opiate funding? The air quality piece is new. We got the sensors, but once we have more information, and we probably won't have enough information for the retreat to talk about it. But are there any other health goals in town? We've been a bit of treading water and doing kind of the legally required stuff, but we really haven't done much above and beyond. We have to do Title V. We have to do restaurant inspections. We haven't done a lot more, as I'm watching other boards do outreach and education, injury prevention, public information, public events. Are there those kind of things that we may want to look at again in that 3, 5, 10-year plan as part of the board's and the department's responsibilities? So I think really back to that kind of, where do we see this board? Kind of like Kevin, I'd love to see this accredited. Okay, so what do we need to do to get there? What do we want? What do we want from the board and the department in the next 3, 5, 10 years? Do we want to be checking the boxes because the state says boxes need to be checked? Do we want to do that? Of course, but also we want to be a proactive health department and not merely an inspection agency. I don't know where that is. I know where I'd like to see it, but I'm not sure what the will of the board is. But I think that'd be a meaningful discussion.
Sounds great. Thank you for your input. Gino.
I haven't too much to say. I'm just to understand there is something wrong with the friend that is chairman of the Board of Health. There is something wrong with the gentleman that is guiding the Board of Health. I mean, I don't see any problem. I don't understand. I have to find out more about it. So I can't give you any question or an answer. I only know that there's 5 people in Board of Health, and we are very nice people. We're trying to do the best we can for the town of Littleton. And we do have a gentleman that is guiding us. So we were for over a year and a half, I think we were fighting to get our own gentleman to guiding us. And all of a sudden now, what's wrong with it? Is people making a comment, or what is it?
No, I think it's more about setting goals and how we want to grow and how we want to, now that we have this, and we have dedicated service and man hours, where do you want public health to go? So we are tackling the mandatory components, and it's a question of how do we grow? So what Dan's talking about is more like community health. You know, what kind of education, what kind of initiatives, what kind of awareness do we want to get out there? How do we grow the department in a responsible way, but being fiscally responsible as well? So, you know, in 5 years, what do you want to see staffing wise? What do you want to see as the focuses that we are primarily working on? What kind of projects, overarching or smaller, can we put in? Where do we cross connect with elder services versus the schools? You know, it's building an infrastructure that has been very isolated for a very long time and only focus on getting by. Now we're looking at building a construct that goes across the town and tackles public health issues that have never been discussed before. So it's up to you where you think the priorities should go towards in the future. So we begin the discussion now to be able to build it out into the budgets and be able to build out some kind of description and get narrowed down focus on where we could put jobs in place.
But you will guide us. Am I correct, Francis?
That's right. But
Okay,
like that's
so
that's the retreat, is to discuss like,
Yeah.
okay, where do we want to go?
Yeah, that Francis, I think it would be like you mentioned, we should have a meeting on our own without even give what the information to everybody. I mean, I like to have something like that. Yes, we can talk something like that. It's very important. But you have to guiding us. So we should have another meeting, just 5 of us, and you included.
Yeah, I think that's the intent of the retreat, Gino, on the 21st, is to actually
Yeah,
have that
thank
meeting.
you.
Yeah, absolutely.
Yeah.
So, I think one of the other things that I'd like to discuss here is also is I know Dan touched on it. I'm going to pile on a little bit with that, as did Kevin. Is definitely more strategic thinking versus tactical thinking. Definitely want to focus more on that. If it's a 5-year, a 10-year, a 15, a 1, 2, 5, you know, whatever sort of kind of plan we want to put in place that lays out some measurement points to say, hey, look, we've made it here. This is where it is. Here are the things that we wanted to tackle and show all that stuff. Getting back to the transparency side of things, definitely the inspections and stuff like that. I really would like to see us try to incorporate some of the inspections maybe into how we present that information for all the inspections. How do we present the information to, you know, from all the other things that we do? Like, you know, what about the list of food trucks that are approved in town? You know, all those kinds of things. We should have an easy way of getting at that information and presenting it to the towns. I know one of the cool things that I saw when I was I was on my travels somewhere. I forget where I was on one of my travels, but they had a QR code on the door of the restaurant. It said health score or something like that, and it had a big QR code that you could scan. And I did, just for grins, and it took you to where it showed their license, their latest inspection, all that kind of good stuff. And it was right from that municipality that you were in that the information came from. I thought that was a really unique way of presenting the information quickly to the citizens and the people using that establishment. So, I mean, again, transparency is kind of the things where I'm at. So that's kind of my two top goals. Is making sure that we have all that information and how we present data to our citizens. So those are the things that I've got.
That's good.
Does anybody else have anything else they'd like to discuss? Francis?
So just to quickly touch on what Dan and Kevin had mentioned. So what they're talking about is the Public Health Accreditation Board, which coincidentally, I actually did mention this to Jim Dugan on Friday. Our 5-year goal is to reach that accreditation. It's going to take time. Probably year 3 is probably when we're going to have the most motion on that. It is about a years-long process. Very few health departments in Massachusetts have it. It's probably a handful. Westford is currently going through it right now, actually. But it is on my list, and I think we can reach it within 5 years, realistically.
Okay, that sounds great. Yes, Kevin.
Are we also able to take a look at the community health assessment data to start to formulate a plan around what we can do to help residents?
There's another.
Yes. I think that's a good agenda item. I have the questions all fleshed out. So I think a good topic would be opioid funds would probably be a good topic to kind of flesh out a little further now. We have some data. The responses have not been a great quantity of responses, but we do have some data. We actually do have some people who would like to be part of more focused groups too, which is good. And we have received some responses of people who work in that profession and are willing to kind of help guide maybe some discussions or some kind of listening group, which is good. And we also just recently got notified that there is a grant that just popped up where the state will provide matching funds for any initiative that we might want to choose to do with it. So it might be looking into further seeing if there's any smaller programs we can match funds for a mini grant, basically. So that's something I'm going to turf to fire, police, and elder services in the schools to see if there's any programs right now that they already have in place that might need a boost or might need a one-time thing that would help their program kind of further its reach. But it would be good to discuss how we want to go forward now that we have some data with the opioid fund money. Listening groups, I think, would be a good concept to talk about how we would want to do that, and how we want to roll out the task force and what the primary objectives would be in the beginning and how we grow that as well, because it won't just extend to opioid funds, it'll also extend to maybe community initiatives and early warning signs with certain properties. So it might become a larger task force than just focusing on opioid funds. And then with the health assessment, if we already have the questions in hand, since the opioid responses were not great, I think it'd be good to have a bigger conversation on how can we roll out the health assessment bigger to get greater responses. And I think in terms of what we're talking about too, I think the budget would be a good discussion to have at the retreat, because it's going to talk about how we're going to grow and how we're going to reach all this. So I've already started to work on it. So if we could have a working draft and kind of discuss how to implement it and working on a 3-year goal kind of, I think that'd be a good discussion as well.
Okay, that sounds great. So really quick summary. I'm just going to go back. I took some notes. I want to make sure people understand. And if I left something off, and it's going to be a high level summary, it's not exact details. Mr. Baker, goal of the accreditation of the Board of Health and have a 10-year plan, I think is something that you kind of said straight out. Mr. Kane talked about an orientation program from the Mass Association's Boards of Health, like maybe going and doing the presentation. He also talked about a 10-year plan and transition into growth. He also has mentioned having, if we are moving away from the Neshoba Health, which was voted on in the last town meeting, that we need to start to think about having a doctor, of record and nursing staff. Looking at transparency, opiate funding and air quality piece he talked about, and inspections, like how do you get out all the inspections? And he also talked about moving from the status quo that we were at into a more board. Gino talked about making sure that we were having a meeting to go talk about all this stuff. He thought that was a really good idea. I talked about transparency, getting the accreditation. Those were the two items that I talked about. And then Francis talked about a public board of health accreditation, a few-year process. And then there's a community health data that we're going to walk through, opiate funds, listening groups, and also talking about the budget itself for like a 3-year, 5-year sort of kind of look at that. I think I summarized all of that. Did I capture most of everything? Did I leave anything off?
I think you did a good job.
Okay. Here, does anybody have any saved rounds? Hearing none. This is just a discussion. I think, is it okay to move on to our next item? Unless anybody wants to have a quick go back. No, I'm seeing nodding of heads and positiveness and smiles. Okay, so we're going to go on to our next item, our 710 ID discussion support tool. Dr. Wason is currently not with us. He's the one that does the ID support decision tool. I know we are coming into the season of other diseases that we like to track to come on board. I don't know where he's at with that. I know we just finished up with our EEE motions that we had, and I thought we handled that quite well. Does anybody have any discussion points in this before I move that we go to the next item?
Go to the next time.
Yes, Dan.
I can share a little bit from a quick peek at the state website. Currently, the severity for influenza in Massachusetts is at the low. We're actually down a little bit since the previous week. This data ends September 28th, so we're a week and a half out. I believe it comes out on Thursday. It's just like the COVID numbers, but flu numbers are in fact down, which is good. The COVID numbers for that same week, there were 1,687 new cases and 22 deaths for that week of September 22 to 28. So it is up a hair. And it's about 2% of all hospitalizations were still around COVID. So certainly nowhere near the front of anyone's minds these days, but I'll repeat my parrot here of it is still out there. If you're willing, and please go get your updated COVID shots, because for anybody at high risk, elderly, kids, immunocompromised, chronic diseases, that it is still out there. And again, unfortunately, 22 Massachusetts residents died the last week of September from COVID. So it is still out there. It is still a real thing. Just be thoughtful, be aware, get vaccinated.
I'll reiterate that message. It sounds great. Any other discussion around the ID support tool? Hearing none, let's go to some administrative matters, and specifically, let's talk about the meeting minute approval. We got 3 meeting minutes in our packet to take a look at. We got July 10th, the 24th, and August 28th. In our packet is the first one around July the 10th. We actually have a quorum to vote on it. So this is good because I wasn't at the July 10th when I was on vacation. So does anybody have, yes, Mr. Baker?
I'd like to make a motion to approve the July 10th minutes as presented.
And
I
do I,
second it.
we have a motion and a second. Mr. Kane, you had your hand raised. Was that for to possibly get a second?
Just
Okay.
a second. Yep.
Got it. Hearing that, I'd like to take a roll call vote. Mr. Baker,
Baker votes yes.
Mr. Kane,
Kane votes yes.
Mr. Fratelloni,
Yes.
and the chair abstains because I wasn't there. So hearing that, I think we have a pass. Let's go into the July 24th meeting minutes. I was there, Mr. Baker was there, and Mr. Fratellone were there. All of us were present. And Mr. Wason and Mr. Kane were absent. Mr. Baker.
I'd like to make a motion to approve the July 24th, 2024 minutes as presented.
I have a motion on the floor. Do I have a second?
Second.
Any discussion?
No.
Hearing no discussion, let's go for a roll call vote. Mr. Baker,
Kevin Baker votes yes.
Mr. Kane,
Dane.
Mr. Fratellone,
Yes.
and Mr. Davis votes yes. All right. Our last set of meeting minutes we have is from August 28th. Mr. Wason, Mr. Davis, and Mr. Kane were present. Unfortunately, because of that, I don't think we have enough people here with quorum to go ahead and vote unless there's a mistake that someone else was present in that meeting. No? Okay. So we're going to have to move that these minutes get tabled until our next meeting when we hopefully have a quorum to vote on them.
Yes.
Mr. Kane.
Agreed with continuing it until the next. Just a quick note. We have board members present. We don't have board members absent. Obviously, we can do, most of us can do the math pretty easily, but just to be consistent with other minutes, it probably should be added.
Yeah, absolutely. And we should also take a look at the health department staff present. Oh, there it is. Okay, I'm sorry.
Yeah.
Okay.
And we'll make a note that it shouldn't be co-chair for Mr. Davis.
Should be vice.
Vice. Okay. I think that is all that we have for minutes. Does anybody else? We don't have any other. Okay, correspondence. Francis, do you want to walk us through correspondence that we received?
So, as we know, the EEE is down to moderate. Notice went out. People are pleased. We have our clinic coming up on the 22nd. So far right now, we have 36 COVID vaccination appointments registered. And they're just kind of slowly rolling in at this point. So
That's awesome. Did anybody else receive any correspondence? Oh, well, Gino dropped off. Okay, we still have quorum. Hopefully Gino will come back and return. Come back, Gino. Okay, we'll proceed on. Did anybody else receive any other correspondence that they'd like to talk about?
I did receive a correspondence about the soccer fields and their porta potties. This will be the first violation notice that we've written up, giving a warning about maintenance.
Okay, that's good.
And it was for, I think, RADA.
Okay. And I received a couple of emails surrounding the EEE as well. It was very informative to receive those emails. And so I wanted to just bring that to the attention that that's there as well. I received no other correspondence. Yes, Dan. You're muted.
I was just going to bring up the some ones that we have seen in our emails, but just to share out that covidtest.gov has reopened as of the end of September. So anyone who may desire COVID tests, you can go online and order, I believe it's up to 4, and they'll deliver them right to your house. So that is a great opportunity, since I know for many of us, our tests we may have had on our shelves are coming up to the end of their useful life. Certainly you can go online and double check expiration dates, because they are sometimes extended beyond the dates on the boxes. But it's a great opportunity if you do need it as we're going into the indoor months, to just double if you'd like to go online and be able to get those. The other one was, I know Francis had shared that we have no new information really about the Neshoba Hospital closure. There's no short-term foreseeable action or options available to change Neshoba's status of being closed. But DPH has made grants available to the EMS in the municipalities around. Okay, we just lost the video.
Yes. 8 communities.
Around Devens. So we've got Devens around Air. So Air, Devens, Shirley, Groton, Tingsboro, Townsend, I think, us, Groton, Pepperell. I think I've got them all. But communities around who has primary transport to Neshoba. I believe it was $250,000 to support EMS infrastructure. So I don't believe it's designed for staffing, but it's designed for equipment, material, things to help as transports are longer, and resources stretch a little bit more thin among the rest of the EMS world, with longer transport times. So a little bit outside of the Board of Health piece, but certainly around Neshoba's closing and some of the impacts that DPH is at least making some efforts to try to mitigate the best they can, without taking over the hospital and trying to reopen it at this time. So.
Yeah, and I know I put a draft of a letter together, and it was up on the SharePoint site for the board. I don't remember or recall that letter. I don't know if it made any further forward progress.
So there's a rewrite in there when you get a chance, Kevin.
Oh, okay, great. I'll go take a look at that. Put it on the to-do. Okay. Yeah. Back to the mention, Dan, about the COVID tests. The COVID test site did open up. I actually did order 4 to check it out. My 4 came and also came with a card that said, even though they're expired, please go check to make sure they're good. Please go to this website to let you know that they're, the vendor has extended the life and blah, 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 blah. So yeah, everybody, when you get them, please make sure you go and check them and all that kind of good stuff. So
You can also visit your local friendly health department as well. I just ordered another shipment that we got this afternoon of COVID tests, and they expire in June. So come visit us. We're passing them out like crazy.
excellent.
Awesome.
Glad to hear that. Have we placed them in any other places in town? Not that I want to have sick people necessarily go to, say, the library, but are there other places that we have given them to dish out?
The only other place that we've given to them in bulk is the elder services.
Okay. All right.
But we can bring some over to the library, of course.
And not that I'm suggesting people who are sick go to the library to go get a COVID test. So they're there for
We're friendly, though. You can come visit us.
I understand. I'm not saying, Awesome. Does anybody else have any other correspondence that they'd like to talk about? And I think
The only other item that I would say is we're currently in interviews for the new administrative assistant for the Board of Health. So we had interviews today. We have Friday as well, and potentially one day next week. And hopefully we'll have a clear idea of who the candidate will be by the end of the week with some form of offer letter. So it's moving. We're getting closer to the end.
And the person I just promoted was Gino. So he came back. So sorry about that, Gino. I just noticed that you were there. So
Yeah, my phone was discharged. That's what happened.
no worries. No worries at all, Gino. Okay. So I think we've kind of naturally morphed into the next item, which was board member updates, comments for discussion. Does anybody else have any other board member updates? Gino, do you have any other board member updates that you would like to chat about?
No, at the moment, no. I think when we get together, we'll talk about it.
Okay. Mr. Baker, anything? All good? Excellent. Mr. Kane, anything else?
I have nothing new. Thank you, sir.
You're very welcome. Mr. Dangle, anything else? Nope, Francis says no.
You did a good job. Both of
Thank you.
Thank you, sir. Okay. I'm looking at the list of participants in our meeting right now for our public input. I see no members in attendance. And we'll wait just a couple of seconds to make sure somebody else has not come in. We are well past our 7:10 item for discussion. So we've waited the 10 or 15 seconds now. About another 5 seconds or so. 2-ish, 4-ish, 5-ish. There we go. Hearing nothing else, I don't have any other items on our agenda.
Mr. Chair,
You did a good job.
Mr. Baker,
may I make a motion to adjourn, please?
I have a
second.
motion before to adjourn. I have a second.
I
Any
did.
other points of discussion? Hearing none. Mr. Baker,
Kevin Baker votes yes.
Mr. Kane,
Mr. Kane votes yes.
Mr. Fratelloni,
Thank you. You did a good job, my friend.
Mr. Fratelloni, how do you vote on adjourning?
I voted yes.
Thank you. And the chair votes yes. This concludes our October 9th Board of Health meeting in the town of Littleton, Massachusetts. Thank you so much.